Awesome. Welcome everybody to our Voices of Support super session in honor of Valve Disease Day 2023. And I'm so glad that you're all here and that we have this awesome opportunity to talk a little bit about Heart Valve Voice US and about the support we offer for patients, and specifically about our monthly Voices of Support calls. So just in case you don't know, Heart Valve Voice US is a nonprofit organization. We're patient-led, and we focus on improving diagnosis, treatment, and management of heart valve disease, and providing support for patients and making sure that everybody gets the treatment and support that they need. And also today is Valve Disease Awareness Day. It's every February 22nd, and here we are on February 22nd, 2023. Really briefly, I want to mention our patient community through Heart Valve Voice US called My Valve, My Voice, and you can access it through myvalvemyvoice.com. And if you're not already a member, please feel free to join us. You can do it on your computer, or you can download our app and have access to our patient community on your phone, which is very convenient and useful. So please feel free to join the patient community so you can get the support that you need. And speaking of patient support, we really want to focus and share on our monthly live support calls, the Voices of Support calls.
Interpreting the documents that they receive.
Hearing background noise, not quite sure where that's coming from. So those Voices of Support calls are every third Thursday, 7 p.m. Eastern Time, 4 p.m. Pacific Time. And those are fantastic, especially with patients who are recently diagnosed or have treatment upcoming, and a way to get the support you need and talk to other patients who have walked the journey and are a few steps ahead of you.
I agree.
So I'm going to come back from sharing my screen.
Yeah, but I think that could be
And now we can see everybody's wonderful faces here.
Okay. Yeah.
And I'm, there we go. And so welcome everybody. I see a lot of familiar faces, which is awesome. Thanks for taking the time to be here. And we want to kind of provide an opportunity for those of you, because I see a lot of familiar faces who come to our monthly calls. And I'd love to give the opportunity for some of you to share a little bit about what your experience is like, what brought you to the calls, maybe quickly share what your heart valve story is and what the calls have meant to you. And then we'll also talk a little bit more. We've got a couple of professionals here. Actually, we have one professional that's leaving. I don't know, Rima, would I put you on the spot if I ask you at the beginning to say anything, or if I ask you a question? And I know you have to leave, Rima, is why I'm like, oh no, we should talk to you.
No.
Okay.
I'm happy to say a little bit if you want me to, and
Rima,
then I can leave. And
yeah, if you could just share what your background is professionally and what you think about the importance of emotional support for heart valve patients and what you've seen in your practice.
so let me tell you, my background is I have an MD and I'm a psychiatrist, and I work at the Peter Cardiac Center in Toronto. So we're a large cardiac center. We see a lot of patients undergoing cardiac surgery, undergoing TAVRs, heart failure. We do heart transplants, so a large variety of interventions. And I love working with the cardiac patients because they're wonderful people who sometimes have run into a bit of difficulty because of a cardiac disease, and they're trying to cope as much as they can. Unfortunately, sometimes people get depressed, they get anxious, There's other complications that might occur during some of these interventions, during surgery. People sometimes become delirious. Sometimes there's other factors that occur, and that's why I get to help and try to sort out some of those problems. And it's actually a pleasure for me to work with these individuals and see them improve. And I think one of the biggest things that's so important for cardiac patients is quality of life. Okay. So all of the things that we do, all of the interventions that we do, all the medications that we give, it's really meant to improve your quality of life. And that's what we focus on. And what are your expectations? And what would you like to get from the work that we do, both in terms of the physical aspects, but also in the emotional and mental aspects? So those are the things that I do at our particular center.
Rima, is it unusual to provide that kind of emotional support for cardiac patients? Because here in the US, in my experience, it seems like it might be, and Liz Perpetua may be able to speak a little bit more about that, what happens in the US, but in Canada, is it common or uncommon to provide the kind of support you do for patients?
So we've got universal health care.
Right.
So you can actually access psychological support without a cost. There are people who are interested in providing support to cardiac patients. You know, are there a lot of us? Maybe not, but there's many of us who do that. So it's not unusual that we'll provide the support, but some of us are a little bit more engrossed in it than others. So I would actually be probably focusing mainly like 90% of my time in terms of cardiac patients, whereas other psychiatrists might do like, let's say 10% or 15% of cardiac care. But there are people who are interested in cardiac care. And I think that's kind of important because you really get to know your patients and you get to know the procedures and you get to hear about things. And I also do research. So that's another aspect. And my research focuses on an aspect that I really think is important for cardiac patients, which is quality of life.
Absolutely. Thank you. And thanks for letting me put you on the spot to share a little bit at the beginning of the call. Since you have to,
it's always a pleasure
leave.
to work with you. I'll tell you that.
Oh, well, thanks. We all have a mutual admiration society among all of us here on this call. Liz, do you want to introduce yourself and share a little bit about your background in working with patients and your interests?
Sure, I'd love to. And thank you
Thanks.
again for the invitation to take part in this call. I'm Liz Perpetua. I am a nurse practitioner, among other things, and I have been in cardiology for it's 22 years now. And I also am a professor at the University of Washington, and I have a practice at the VA here in Seattle. And I started actually working with patients who have heart disease or heart conditions way back in the late 90s. And I also had worked in mental health, and that has always been a big love of mine, is what does wellness and well-being look like to all of us, because that means something different for me and something different and unique for each, individual. And in, my journey, I moved from being a nurse in intensive care and in all the different cardiac specialties to then being a nurse practitioner and then an educator and also researcher. When TAVR or transcatheter aortic valve replacement and some of the other minimally invasive therapies, like there's all these, alphabet soups, right? Like TEER or mitral therapies that are without cardiac surgery. I was a research investigator on those trials before they were FDA approved. So I had the opportunity to work with almost every hospital in the country that has launched their programs. And I have a special interest really in team building and ensuring that our patients are really at the heart of that, and that people are empowered to be able to share their goals, their perspectives. And that's largely where a lot of my research and publishing is at this time. So I see some familiar faces here, Alan and John and Kathy and Michael. Nice to see you again. Thank you for all of your candor and your input. Susan, just to answer your question about the power of community and emotional support. I think that the way that we take in the world and the way that we experience our health helps us actually recover, helps us stay resilient. And in times where, our patients or people are told you have this life-threatening disease and, you need treatment by a certain time because it has a high, risk of death or disability if we don't do anything. And we have to have this surveillance for, the rest of your life. We're going to, be taking good care of one another, communicating for, our lifetime. So in doing that, having community where people who have walked in one another's shoes and can actually, shine a light on some of the, more obscure or even like the areas that are like a black box, it's so helpful. And actually hearing that you're not alone, that your questions are totally reasonable and actually great questions. I see John and Kathy nodding and people nodding. I mean, just hearing that it's going to be okay, and seeing someone on the other side of that, whatever their story looks like, it's really meaningful. And that connection, I feel, helps us not only in the specific like procedural space when there's a question about undergoing treatment, but in all of that continuum. So I love what Heart Valve Voice has given a platform for, because at the end of the day, we want there to be care in healthcare, and it's not really about us saying, well, here's what we're doing. It's really about having conversations. So I think that's what Heart Valve Voice, right, and all of you have really, at least for me, in the meetings that I have been in, that's what I've experienced. So thank you.
Thank you, Liz.
Oh, you're welcome.
Actually, this I think is a really good transition opportunity to have a conversation now with some of the patients and care partners who are on the call, to hear a little bit about your stories, and then also to hear about what our monthly support calls have meant to you and what you've seen it mean to other new patients who have joined our calls. I see John's got his hand up. Do you want to add something, John, before we move to that?
Just quickly, and thank you, Susan, and just on the transition and building on what Rima and Liz said, and Liz and I joke because I always tell Liz she's one of my 10 favorite board members. That's a bit of an inside joke. But just building on that, and I'd be very interested in hearing from the patients, from the care partners, and from the professionals on this call as well. One of the things we've been really trying to investigate and are considering doing our own research on is this role of emotional support and mental health services parallel to this patient journey, and looking at ways about whether that could be included in the formal heart team, for instance, or when that should be integrated into the system, and how that may improve outcomes or improve satisfaction measures. And so it's one thing we're very interested in, but I would just love to hear any thoughts anyone has on that concept. Thank you.
Well, I'd be happy to jump in here.
Yeah, thanks, Alan.
I know some of you have heard my story before. I won't go into tremendous detail other than saying that back in 2006, I was initially diagnosed with aortic stenosis, and I cruised along for a long time, mild and moderate, and all of a sudden it took a sudden dive and got very severe. And as many patients have experienced, I'm sure probably all of them or nearly all, the tremendous anxiety you feel, the fear of mortality, and there are just so many questions. The anxiety is, many describe as the worst part of it. Part of the comforting part was finally, again, it's a long story, but finding a care team of doctors and the team that will be taking care of you medically But to speak to what John was asking about, the not knowing what's going to happen, what to expect, how things go from an emotional standpoint, and how to best deal with that. And peer groups like this, support groups, have been just invaluable to talk to others who have gone through it. Everybody's circumstance is different. It's very complex. There's so many variables, but being able to ask questions, find out how people dealt with it and their outcomes was extremely comforting. And once I found that I had a plan from my cardiac team and I knew what to expect my experience to be, because when you go to the hospitals, they give you a packet. Oh, you'll show up here and you'll be here this long and here's what you bring, but not how to deal with it really emotionally. And so peer groups like this have been absolutely invaluable to help get through it, and then all the aftermath, how you deal with it, and then the desire to pass along my experience to others, because I know what they're experiencing, as all of you have gone through this are as well. So just
yeah, John, Alan, you had your TAVR just last summer, is that correct? Was it July? Am I remembering?
That's correct, Susan. Yeah, I was 7.5 months out. I go back in June. I'm in Texas, and part of my story was my cardiologist, when he saw how bad it was getting, he said, well, also my complication was I have a liver issue. I have non-alcoholic fatty liver cirrhosis stage 4. And so I couldn't have open heart surgery. And my cardiologist said, oh, TAVR is just experimental. You just probably won't make it. So there's really nothing you could do. And it was mind-boggling. I went to then University of Texas, and they were a lot better, but there was still a lot of unanswered questions. And in the meantime, I got a second opinion from Cleveland Clinic, which was they're just so outstanding. And we decided to go there for my procedure. And I'm absolutely thrilled of the outcome and the way they handled everything. So I just think that having that kind of confidence was a lot. Also, this is my wife, Cindy. She's been my
Hi, Cindy. So glad you're here.
She's been my chief researcher and support. That and my dog Elliot. Come here, Elliot. Come here, Elliot.
Yeah.
He's laying down now. But just having support from friends and family and has been invaluable. To know that you're loved and people care about what's going on has just been wonderful. So I'm just very, very fortunate the way it went for me, and I just hope other people have as good an outcome as I did.
Yeah, Alan and Cindy, if I'm remembering correctly, help me here. If I'm remembering correctly, I think the first time you joined our call and the first time we all met was within 5 days of your TAVR. Hadn't you just had TAVR days before, and then you joined the call?
You have a mind like a steel trap. Yeah, actually, I was lurking on the Facebook site for a long time and just reading other people's experience. So I gained a lot from that. And then after again, Cindy found she's retired from the Baylor College of Medicine, has a great background in research, and so she's been fantastic to help learn about this.
There's some other people that have gone through this, and maybe there's a group on Facebook. Let's see what we can find. And sure enough,
and you found us.
Well, one thing I want Cindy reminded me to touch on as far as things to get through this was the cardiac rehabilitation and the importance of that, and going through that, not just the physical part of going there and putting the work in, but that's another type of support group there, because when I was there were people who have gone through the same thing. And it's not like going to a gym where, you're into powerlifting and that kind of stuff. Everybody's there to accomplish something. And just having that other community who you can relate to that have gone through that, and a commitment and knowing, okay, I'm committed to going these 3 days a week and all. You could do the work on your own, but I think cardiac rehabilitation is another type of support group that people should really take advantage of. They benefit from it. I did.
Yeah, that's a great point, Alan. And thanks to both of you. And I'm thinking now I want to kind of switch over to John and Kathy Sapp, because I'm remembering when I first met you both. First heard from John, I think a few months before you had TAVR. You'd been recently diagnosed, and you sent me an email. And to paraphrase what I remember you saying, John, and you and Kathy both can elaborate a little bit more about it, is you wrote me and said, you know, I've been an OR nurse for 30 years, and I've been in the OR and I know what it's like. And now all of a sudden they're telling me that I need to go as a patient, and I feel really differently about it as a patient, and that it's really frightening. And so could you guys take it from there and talk a little bit about what finding other peers and support and being able to talk about it has meant to you? And then, like Alan and really every other patient on this call, you've chosen to pay it forward and share your experience to help other patients as well. So we'd love to hear a little bit more about your story and about what support has meant for you to both receive it and give it.
Well, the best thing about this, my whole story, to make it really short, was that I heard at the beginning of the call that there were physicians, primary care physicians, that are not listening to patients' hearts. And that's, you know, to me, that's a mission of mine. And, you know, everyone that I get a chance to talk to, one of two things is, you know, if it hadn't been for my primary care going, wow, you've got a little murmur there. Mm-hmm. We need to follow that. They followed it for 13 years.
Wow.
And then, you know, that brought me to TAVR. And then the other thing, what Alan mentioned, is, you know, my other mission is that I try to spread to everyone, and trying, even speaking with some of the cardiologists and cardiothoracic surgeons where I work at the University of Florida, UF Health, is cardiac rehab and the importance of it, and the support that Alan was talking about. And not only that, but one of the major parts of the anxiety for me was, you know, just the insecurity of knowing, you know, what's going on. And the cardiac rehab component gives you such you know, the whole team there. You're on a monitor, you know, everyone's there to help you. You're around people that are in your same situation in different stages. So you get a real sense of, it brings that anxiety level way down and adds to your sense of security, which also adds to your sense of well-being. And then, of course, care partners.
Well, and I was going to chime in there. So crazily enough, while this diagnosis was transpiring, you know, we were going to the gym 3 times a week. You know, we were walking. You think you're okay, and then we get this, and his cardiologist is like, so I kind of would like you to not do what you're doing until we kind of figure out where we need to go from here. And then, of course, you know, fast forward, TAVR's done, he's home, and in my mind, as his care partner, I'm like, I was scared to death. Like I didn't even want to go for a walk, because I thought, what if something happens? And the cardiac rehab for sure just gave a first of all, I got to go with him for the first appointment, meet everybody. They kind of laid out what they were going to do. They definitely just the ease and peace of mind that they gave me, knowing that as he was continuing, you know, with his new little valve, that he was being monitored, and, you know, it was 3 times a week, and he was there for an hour and a half, you know, each session. And it just, to me, it's a huge component, and they listened to us because it was not something that was said to patients. And now not only was it said, they have moved the cardiac rehab from wherever it was, another part of the hospital, into actually the HVM section of it. And it's almost required. I mean, they're going to require you to do it, but it is. And I saw Elizabeth clapping. Let me tell you, that was like a huge win. So know this too. I mean, our voices are heard amongst each other on this call, but even greater, I think it has given us, all of us, kind of this little, I don't know, supernatural bump of strength, or, you know, a voice, not, you know, we're not scared to speak out and go, okay, wait a minute. And even part of our journey was, we were open heart first, and we became a part of all of this and went, we have a voice. Why are we not asking about this? And why can't we do this? So again, just full circle, it has helped with the roller coaster of emotions. It has helped with some beautiful relationships that I have kindled, all the way over to somebody that lives in Hay and Wye in Wales. Meeting Susan, John, and all the other familiar faces, Alan, and Michael disappeared, or he's invisible. I'm not sure what's happened there. It has just made such a tremendous difference when you can get around people and just in a safe and trusted environment. And that's super important, super important.
Right. And Kathy, for a follow-up question, I know you have a real heart for care partners, and Cindy may want to chime in on this too. And we have talked and put together a separate kind of private care partner support area in our patient community. Can you talk a little bit more about care partners needing support?
Yeah, you know, he's going through obviously the range of emotions, and I have a whole different set. And I'm trying to be, you know, remember one of the conversations I had with him was, you know, I am your biggest cheerleader. And he's just like, I'm going to die. And I'm like, not the answer. It's not the answer I was looking for. And it's like, what do you do with that? And I mean, I'm telling you, Cindy, you know what I'm talking about.
I do.
We're absorbing the information and going, okay, like, we knew this was a huge deal. I didn't know at first, but me and my computers and fingers and people, and, you know, it was, and then I knew that there just has to be somewhere that I can talk to people without him, because there was a whole range of emotions that I was going through that I knew others were out there too. And Susan, you and I started talking about it, and we're like, oh my gosh, let's start this care partner group. And this is where it gets hard, because as much as I try, like, hey, join the group, get into the group, it's trying to convince people it's truly a safe space, and that they can really just unload and just know that it's okay to not be okay. And it's okay to have questions, and it's okay for your emotions, you know, at the exact same moment, to be totally different than the patient, your husband, wife, mom, sister, brother, aunt, uncle, who's going through it. And that alone for me has just been just a huge win. And I know, Cindy, I don't know about you, but the day we found this out was through a wonderful, you know, we have my chart with UF Health, and we found out before, it was on a Saturday morning. His test results dropped from the Friday before, and I was 3 days post-op. I had major surgery. And he walks in and goes, I have aortic stenosis. And I'm like, oh, okay. I mean, I didn't know. and then here we go on this crazy journey that we're now a year and almost 6 months post TAVR. So, yeah.
Yeah, as care partners, because I think a lot of us on this call have experienced being a care partner, even if you're a patient too. And for me, I found being a care partner, you want to be strong for your person that you love and support. And it's so important to have somewhere where you can go to be vulnerable and share the fears or the not knowing what to do, or or whatever, you know, where it feels safe not to be strong.
Yeah, even having the space to say, you know, I'm exhausted, because I want to tell him that, because like you said, we're supposed to be strong, and Cindy's supposed to be strong, and you know, we're all supposed to be okay going through this. And there were just days that I was mentally, physically, emotionally just spent, and I just had to keep going. And just even be able to verbalize that sometimes helps. Just be able to talk to somebody, or even type a little post out that says, today was a tough day, I'm just tired, you know. And
because just because you're tired, you don't want to put that burden on your patient. You know, you don't want them to feel somehow responsible or guilty or what have you, because that's not your intention at all. But you don't want to ask them to support you because they're going through their own thing. Yeah. So yeah, the care partner job is a challenge. Cindy, do you have anything you want to add to that?
That was beautifully said, Kathy. Part for me, yeah, I mean, it was so great just to listen, to hear what you were feeling, what care partners were feeling. Because usually I'm the one talking all the time. So that was good. That was just a good time. But I worked for a medical school and a cardiologist for years. So there were a lot of times that I think Alan just really, and I'm not a medical person, but I was an administrator, that he expected me to be able to interpret all the medical stuff. And I love looking and reading, and a lot of it was familiar, but I often felt very inadequate. Just to be able to really explain exactly what an ejection fraction was and what all the test results were. So that was kind of, it was intimidating, and it does just wear you out. I wanted to be strong for him.
And she was.
Well, that's awesome. I'd like to move on to a couple of patients who are with us and kind of waiting quietly in the wings with us. And both of you are just so special in your own right and important in what you do. And Christine, I think we'll transition over to you, because you might want to speak to both the patient and the care partner aspect, because I know you've experienced some of that. And then also two of you can share a little bit about just what the peer-to-peer support of being able to share in groups and you know, just tell us everything.
Sure, no problem. Well, thank you so much, everyone. It was great hearing all of your stories and all of your perspectives. I do have to say, just kind of piggybacking on just the caregiver portion of what you guys had said, was first and foremost, I will be celebrating my 10-year repair to my mitral valve via open heart surgery this June 13th. And I have to say, just hearing just the perspectives of the caregivers have really resonated with me in terms of my husband and then also my mom. Back 10 years ago, when there was not this community, I have to say to you, just hearing the caregiver's perspective of how important this community is, and how I only wish that my husband had some place to turn to. I only wish that my mother had some place to turn to, because I have to say to you, as a patient, we are so tunnel visioned in focusing on how well or not well that we are feeling. To be honest with you, I didn't even think about my husband's perspective. I didn't even think about my mom's perspective. And I know for me, they only had each other. They didn't have the beauty of this support network. They didn't have the beauty of communities to be able to go to and find out, where do I go to find the research on, wait a minute, why is Christine once again in AFib for the third time? Why is she getting cardioverted? For the third time? Why is it that she can't participate in cardiac rehab? And I have to say to you, I think that stressed out my mom so much that I think she became fully gray. And she then started escorting me to cardiac rehab because I wanted to participate so dearly in my cardiac rehab sessions, but I couldn't even get past the blood pressure check and the heart monitor check before I could even start my classes, because my heart rate would be anywhere from like 160 to 180 beats per minute. and they wouldn't let me go home. They had to, of course, then cardiovert me to get me back in normal sinus rhythm. And I think my mom was deathly afraid of every time I went into cardiac rehab. So here I am, a grown adult, having my mom come with me, and all she had were the nurses to be able to kind of explain, like, hey, what's going on? So definitely a tremendous growth in this type of a community, even this type of organization, Heart Valve Voice, and truly lending the patient's voice to be able to speak about our experiences. And for me, I know personally, my mission, like those of the patients here today and of those that were also in our calls since the inception of this group, I know is my mission personally is to pay it forward to others. I know I'm a little unique in the sense that most patients during the calls have been TAVR patients. But for me, regardless if you're a TAVR patient or if you're an open heart surgery patient, our fears are still real. Our fears are still the same. Again, I usually kind of say, we have many different rhythms. Our heart has many different rhythms, but we truly are united by one heartbeat. And that one heartbeat is understanding, what we're going through, the what ifs, the why me's, and things of that nature. And just recently, as Susan had mentioned, I've taken on the caregiver role for my elderly aunt who had to have a Watchman device implanted a couple of months ago. And once again, be that resource and to be that advocate for an elderly patient, escorting her to the medical appointments, and just knowing based on my own journey, in my own questions, in my own lessons that I learned, that it is so, so important to be your own advocate. And when someone is elderly at 83 years old and not ever having experienced AFib, basically due to having to go to an emergency room because she fell and hit the back of her head when she was going out to get the mail one evening, it's a world that's unknown. And being able to have communities like these is just so, so, so important, because again, even as a caregiver, I'm learning from those caregivers that are here that it is important to take care of yourself. I mean, having to wear so many different hats of, being a wife, a mom, an employee, a caregiver, a daughter, a sister, and the list goes on and on and on. It's just, being in the caregiver's perspective and just listening and learning from the lessons that you guys have shared is also very important for me as well.
Thank you. That's so true. And before we go over to Michael, I just wanted to add that what's striking me too, but with this conversation we're having today and with what happens every month on our calls, is how we can show up on a call and start off initially as complete strangers, and yet so quickly feel a sense of community and a sense of connection and a sense of safety and ability to really share pretty deeply usually, and feel like other people are there and witnessing and understanding very, very clearly your experience and your emotions and all of it. And there's something just really powerful about that experience of community among strangers, because we have a similar life-threatening experience. And Michael, I want to switch over to you, and quickly I want to say welcome, David. Really glad you were able to join us, and we'll get to you in a minute too if you feel like sharing. But Michael, I wanted to get to you because you have been such an important part of our calls every month, and you are another one of the open heart surgery patients. And I wanted to say that I was about to say, yeah, you're kind of famous even in the group, like this last call yesterday, because you gave some really great advice to a person who he was scheduled for TAVR just a few days after the call and was actually very anxious and literally was considering canceling his procedure. And what you had to say to him really impacted him and gave him the courage to move forward. And he was on yesterday's call post TAVR and thanking you for how you had helped him. And again, complete strangers connecting and helping one another. So Michael, we'll turn it over to you for a minute, and we'd love to have you share.
Thank you, Susan. I have one follow-up question to what Christine was just saying. Did I hear you correctly in saying you are going to be having your open heart mitral valve surgery soon?
No, actually, I had my mitral valve open heart surgery. It'll be 10 years this June 13th.
Oh, 10 years. Okay. Well, I'm a little bit before you. Mine was 15 years ago.
Okay.
But it wasn't a replacement surgery, it was a repair.
Same
Which
repair.
basically is a lot different in the fact they don't take out the actual valve tissue. In my case, they took out all the tendon cords that held it in place and replaced it with a piece of plastic, a ring. And you may, the other participants may know this company, Susan, you too, Medtronic.
Mm-hmm.
They continually keep me alive with their little plastic ring.
That's awesome.
That's
If
all
only
it
they could like
takes.
pay for the
And-
ad. No, I'm kidding.
I've been going strong for 15 years, and the one main reason I think everybody else knows that, like I said on Tuesday, the main reason I'm here is to anticipate what I need to know if the TAVR comes into play for me in the near or distant future. I want to be aware of it. So if there's if Christine's experience is anywhere close to or different than mine, I'm open to hearing about it. And I'm also open to sharing my experiences. But like I said, mine was open heart, everybody else's is TAVR. And
I'm open.
we're still one family, one umbrella of heart disease, one way or another. Because what I experienced was valvular disease as opposed to anything else.
Mm-hmm.
But that's all I can tell you right now. I had my surgery when I was 58 years old. And now I'm 73 and still going strong.
That's awesome. And still paying it forward to other
Yes.
people, which is so important. And whatever type of surgery or procedure we have, that the emotional experience behind it is so similar that we can all relate to one another. And everybody is welcome on the calls every month, whether you're newly diagnosed and looking at upcoming treatment or trying to decide what your treatment is, or whether you're a year past your treatment or 10 years or 15 years. We all have something to share and contribute and to help one another.
One other thing I wanted to add, this is very, very, how should I say, pertinent. When I had my open heart surgery, I was told that it opened up the incision, chest incision, opens up the emotional system. So that a person who didn't used to be a crier, tears, will probably now, after that surgery, be 40 to 50% more vulnerable to crying, even men. And I always tell them now when I'm visiting, you know, as I've said, I'm with Mended Hearts, that if they ever have the urge to cry, do not resist it. It turns out, FYI, that about 4 or 5 weeks ago, I was sitting in a restaurant with my wife for dinner. And 15 years later, out of the blue, I started sobbing at the dinner table. And it didn't matter why, it didn't matter what caused it. My wife immediately suggested, go to the restroom and see it out. So I did. And then the waiter who saw my tears asked while I was gone if I was okay. But it's like, you know, out of the blue, I started crying and I didn't know why, but it was that brim coffee idea, fill it to the rim. The tide in my body hit that point where it had to overflow. And that's the how should I say, the example that I use. Whenever a person feels that brim coffee overflowing, that's the tears that want to come out. It doesn't have to be tears, it can be laughter. The point is, it needs to be released. And
Yes.
that's the example that I always use, because it's an example of your body is constantly healing forever. It's not
Oh,
just
Michael.
no, seriously, forever.
No, this is why we love you, and we're so glad you're on our calls every month for the wisdom that you share.
Well, my cardiologist told me that once that surgery is done, your body's going to be constantly healing for the rest of your life, even though they tell you the full recovery is a year or a year and a half. It's the rest of your life to some degree, percentage, regardless of how small. So whenever my wife sees that coming on, she knows what to say.
What a beautiful partnership you and your wife have. That's great.
So anyway, continue everybody else. That was the awareness, the experience that I wanted to share.
Thank you, Michael. Thank you. That's just beautiful. Well, David, I just wanted to come to you because we're getting toward the end of the call, and wanted to say we're so glad you were able to make it. I know you had another engagement before, and so glad that you could find some time to join for near the end of our call, but would love for you to take a moment if you would like to, and share a little bit about your story. And
well, I'm the oldest person on the call by a long, well, not by a long shot. I'm 78. And I had my surgery 9 years, 2 months, and 5 days ago, to be precise. But who's counting? I'm not a crier, but there we are. I laugh at jokes if they're good jokes, and that's good. But above all, the interesting thing is I don't think about my valve most of the time, which is just as it should be. It's there. I mean, I know it's there. It has allowed me to have a full and rich life since then, since the surgery. And I have to tell you, I'm a journalist. I've reported from 86 countries. I've done probably at least 15 or 20 in the years since my surgery. And that's great. And, you know, we have a place in Paris. We spend about a third of our year there and traveling around other parts of the world as well. You know, the interesting thing is that neither my wife nor I really think much about that, although she was a wonderful caregiver. Now, I had an open chest surgery. It wasn't totally open. It was, that is, they didn't have to break my breastbone, which was good. It was done with basically, it's interesting. You can actually see my surgery online. I was then a columnist for USA Today, and we filmed my surgery. I was out completely cold, of course, but you can see all of the television monitors around the operating table. And that's how they did the surgery. They put a camera down into my chest, a very small camera into my chest, and they did the surgery using the images off that camera. I don't think the surgeon, who was one of the best, Aubrey Galloway at NYU Langone, I'm not sure he ever actually looked down into the chest. I don't think he could have seen it necessarily. It was beautifully done. The healing process was considerably faster, although I do still have a bit of a zipper there. I did have a zipper on my chest. You know, and it was a process. It took probably, it didn't take a year and a half, but it certainly took some months before I was really back to normal. When I say, I mean completely normal. But, you know, today I usually do 20 minutes on a rowing machine. I do a half an hour on an exercise bike. I do, you know, probably another 20, 30 minutes with weights and so on. I'm not terrifically strong, but for a 78-year-old, not so bad. My biggest problem is I have asthma and my lungs are not all that great. So, but with my heart valve, and it's an Edwards valve, you know, I basically, I've done very well, and I can function pretty normally. I'm going in next month for every 2 or 3 years, I have an echo just to make sure everything sounds good. But I see my cardiologist 3 times a year, and he listens to it, and he says, "It's great." You know, I said, "I don't hear anything." I said, "You don't hear anything?" Well, he said, "I hear your heart." He said, "But I don't hear anything about from the valve," which is good. You should not hear the valve. That was one of the things that I was told frankly, that's how my pulmonologist realized I may have a problem with my aortic valve. He heard something funky. So he sent me to a cardiologist. The cardiologist began monitoring. After 2 or 3 years of monitoring, he said, "You're going to need surgery." And I went in to see the surgeon. And this was on, I guess, in November. I was planning to go to Paris for the end of the year holidays. And I said, "Well, why can't we do it? Can we do it at the beginning of next year?" He said, "I wouldn't go to Paris."
Oh.
So that was my indication. I should get it done now. So we had it done on December 17th, literally 9 years ago. And it's great. And not only that, but and by the way, I'll send some folks may have the actual link, but if someone can get the link to you, you might be interested in seeing the surgery. I did a video, it's about 2.5 minutes or so. And it'll show the whole thing. So, and it's great. I was not TAVR. And I kind of wish I'd had TAVR at the time. I'm told that if I have to have a refit, they can probably do it with TAVR. But so at any rate, I'm very reassured. And the nice thing is, so at any rate, one other interesting thing happened after I did the surgery and this thing came up. Mike Masalam, who's the CEO of Edwards Life Sciences, he saw this and he said, "I know who made your valve." I said, "Well, you guys did. It's an Edwards valve." No. He said, "I know the actual people who sewed your valve." And I said, "Oh my." He said, "They're in our Singapore operation." So we had lunch in New York. He said, "We're going to fly you out to Singapore and meet the people who actually sewed your valve." And there were 20 people, literally 20 people on the team that did this. Even it's a little valve about that big, but it requires hundreds of stitches meticulously made by hand by these and they use Malay Chinese seamstresses. They're women, all women, and they have this tremendous ability to stitch these tiny little valves so perfectly in a clean room. We had to go in and with suits on and everything. Everything is absolutely so clean and sterile. It's just a wonderful and that was a wonderful experience. So you got to do it. I mean, there's no doubt about that. I know people. When I was researching the story, there was an NFL coach who on the sidelines, manager of a team, one of the NFL teams, he thought he could get through the whole season without having his surgery. He collapsed on the sideline and they just made it to the hospital and they did his surgery just in time. He didn't make it out of that NFL season. So, if they say to do it, you do it when they say you do it. And you'll be reassured enormously. So as I say, it's almost 10 years now and knock wood, right? I'm pretty good. So what are your thoughts though? If you have any questions, I'll be glad to answer them.
Well, thank you. And thanks for sharing your story. And
I'm
glad to hear you're doing so well.
Alan's the guy who's really we're talking with today, right? What are your worries? What are your concerns? Or what are your fears? Or what are your questions?
Well, my fears are all taken care of now. I had my TAVR 7.5 months ago. I had a lot of anxiety that I was discussing how the group and others who went through this helped me through so much. Thankfully, mine went without a hitch at all. And I'm just one of the very fortunate ones. I know other people have had issues and my heart goes out to them afterwards. And my outcome just could not have been smoother. And I'm doing the rehab and I finished the cardiac rehab, but Cindy and I go to the gym now regularly and can continue to work and get healthier and trying to change our diet and all that stuff. So I appreciate you sharing your story. I would love to see that your story on the surgery too. That would be awesome if you could share the link to that.
That's great. Well, we're actually right at an hour together, everybody. It always goes so quickly whenever we do this. Does anybody have a last word or phrase or anything you want to share in terms, especially if it's about the importance of, peer support and maybe encouraging someone who might be watching this, who's thinking about joining one of our monthly calls, a last word of encouragement for that, or also I'm hoping that hospitals and other organizations who might watch this recording too would think to share the resource to for their patients who are newly diagnosed or facing treatment soon, because it helps. So anybody have a last word before we sign off for today?
Thank you for doing this, Susan and John, and all those involved in putting this on. It means so much to so many people that you probably don't know how many people you've touched.
Well,
Yeah, I was
thanks.
literally gonna say the same thing that Alan did, and just all of you, or it's just a beautiful community, and just truly praying that as you were saying in the beginning, that we can get this into patients' hands in the beginning, not even, like Cindy said, dig and try to find, like it's a resource handed to them would be prayerfully our next step for sure. Yeah.
See so many people on the Facebook group that would benefit so much, and plus others aren't even on Facebook. I wish the word could get out a lot more about the monthly calls and how meaningful they are. I don't know what can be done for that, but it's a shame that that's not utilized more, because it's the most wonderful resource, and to get to know all of you, and it's a lot more personal than just a Facebook post.
And one thing I also did want to mention too is for those people that may be camera shy, we do have the ability to be able to post questions through our app. And I think that's also very important to get the word out that way too, and into also the hands of the hospitals and that too, because I know oftentimes people, may think, well, I'm a little camera shy, I don't really want to go on camera, but know that there are resources available on our website, to help patients and caregivers as well. And so I think that's definitely something also to keep in mind, because we've also featured, people's tips and tricks and how to prepare for open heart surgery and things of that nature. And so that's definitely also a very invaluable resource as well.
Yes, and I just want to tell everybody too, thank you, Christine, that David posted the link. So if you want to get that link out of the chat to see the video that he talked about, that's available. So grab that before the call ends. Anybody else want to give a last anything? John Lewis, our fearless executive director, would you want to say anything? Or I want to just make sure also that you got formally introduced. I wasn't sure if that happened, but we're thankful to you for your leadership for the organization.
Well, thanks to all of you for participating and for all you do to support other patients. It's so meaningful. It's probably the most valuable thing we do as an organization, and any way you can help us grow that patient-to-patient support, we really appreciate it.
Thanks, John. Well, thank you everyone so much for taking the time to be here, and we're just so glad you're here, and we invite everyone here and anybody watching this to join our call each month, third Tuesday of every month, 4 p.m. Pacific time, 7 p.m. Eastern time, and join our patient community to the myvalvemyvoice.com. So thanks everybody. Happy Valve Disease Awareness Day. Thank you, Lindsay, for joining us from the Alliance for Aging. And until next time. Oh yeah, let's sign off with our glasses, everybody.
Love to you all.
Yes.
Thanks so much.
Thanks.
Happy Heart Valve Disease Day.
Yes. Bye, everybody. Thank
Bye,
you.
everybody.
Thank you.
Bye-bye.